What is up, YouTube fam? Back today again for another vlog episode. Today we are going to be seeing my chiropractor, Dr. Ryan. About a year and a half ago, I was suffering through some of the worst back pain I have ever experienced in my life. At the time, I was only 27, now I'm 29, and my body is, changing. I'm getting older, and I can't believe that my muscles are reacting differently than they used to. I was having troubles sleeping, sitting, golfing, exercising, that I was living in constant pain. I saw a handful of different chiropractors, massage therapists, acupuncture, and it wasn't until I met Dr. Ryan that he totally changed my life. What he does is he shows a rolling technique that is way different than foam rolling that you might be used to. Dr. Ryan works with so many professional athletes like NHL hockey players, PGA Tour golfers, professional weightlifters, that he's seen so many sport injuries or muscle injuries in general, and he's able to work up a game plan to help us feel better. So I'm so excited to introduce you to Dr. Ryan. He changed my life, and hopefully if some of you guys are battling muscle pain, he can help you guys too. So let's go over, meet Dr. Ryan, and come up with a game plan. All right, YouTube fam, welcome back. Today we are at Dr. Ryan's, as I mentioned in the intro. Dr. Ryan changed my life with all of his rolling techniques. So Dr. Ryan, why did the rolling change my back pain?
That's always a great question. Now, when we look at rolling, what is rolling? Rolling is simply self-massage. We know that massage works. Massage is great for strain, and that's what we have to look at. What was wrong with your back? The problem with the back is that it's excessively strained. And so when you look at it, just going for a periodic treatment wasn't going to be enough because, well, you didn't stop. And so what we want to do is we want to help the low back heal more than we hurt it all the time. So because we can roll multiple times a day, it just can do more than anybody like myself could do for you. This is why I teach rolling, because rolling can help you do things in between a treatment or do it on your own so you don't have to rely on someone like myself.
So Dr. Ryan, I've talked to some people about my rolling experience, and they say rolling doesn't necessarily always work for them. Why does rolling work for some people and it might not work for others?
Okay, that's another good question, and that's just because there's a lot of variables to rolling. So people just see rolling generally on YouTube. They look it up and they're like, oh, that looks like it's right for me, without considering all the important variables. And what are those variables? Body position. So if you're not in the right body position, you're putting yourself at risk, and you're actually not even on the appropriate muscle that you're trying to roll. The other thing is the technique. So what I do is a specific technique that I teach, and the technique makes it therapeutic. And what does that mean? It just means that it's gonna create therapy to the body, not just say like a relaxation massage. You're gonna do a therapeutic massage. And the third thing, and probably the most important thing, is the tool. So we're gonna touch on some tools today. And if the tool you use is not right, it's actually not going to get deep enough. So with those three variables, it's very important, because if you deviate on one of them, it will be ineffective. It's not that it will maybe work, it is ineffective.
Okay, Dr. Ryan, let's get into our tools. Yep. So let's grab this purple guy. What is this, and how are we using it?
All right, so this is a therapeutic foam roller. It's a travel roller. I like it just because it's one of the tools that I've been able to test and use and can guarantee its effectiveness. What I like to do is offer certainty to my patients and to any of your listeners to make sure that if I roll, I'm gonna get the effects that I'm looking for. This is what I like. It's just very versatile. And what a lot of people have is a traditional roller. It's like 6 inches big, but what I remind people is the bigger it is, the more surface area it's going to contact, and it's going to get less deep on a spot. It's kind of like me pushing my palm against a muscle versus my thumb. I'm going to get deeper with that smaller surface area. Hence the progression. So if we go now to the ball.
I was going to ask you about the ball, because I'm not a softball player and there's a softball here. What are we doing with this?
So progression. For people like yourself that have a great tolerance and have rolled for a while, a softball is a perfect tool to progress to from the roller, because it's super dense and it's the perfect size for maneuverability to get deep into the muscles.
Okay, Dr. Ryan, let's get into a little bit of the anatomy. So where are we going to be rolling?
All right, so today we're going to roll 3 muscles, and they're important for golfers just because of sometimes aches and pains that they get, or mobility and flexibility. So the 3 parts we're going to cover are going to be the low back, the glutes, and the inner thigh.
Okay, we've made it to the ground, and we're going to start with some kind of beginner rolling. So where am I going to start in just positioning the roller?
Okay, so the key thing, as I've said before, is body position, technique, which follows that, and then using the right tools, of course, because with a beginner, okay, we're going to start with the beginner position and the beginner tool. So that's where you're going to use the roller. So you're going to lean back on your elbow, and you're going to put that under your low back. Now, when we talk about low back, that's above your butt, above your pelvis. So you shouldn't feel anything bony. Exactly. So what I want you to do is just bring that other arm behind you, because what's going to happen is you want to get your belly button up toward the ceiling. The more you turn, you can get closer to the ribs and further from the center. Now, remember that the spine is right in the middle, so we want to be just beside that on there. So you're in a great position, and remember that we're going to move segmentally. Each segment is 10 rules. So we have a rule, and that is the 5-10-2-2 rule of rolling, which is basic, which is a guideline. We can do more, but we stick with that to start until we learn tolerance. And that is, you're going to go in a vertical line down the back, 5 segments, 10 rolls each, twice through, twice a day. Okay, to get results. So you're going to start there, and then you're just going to start doing a little rocking head to toe. I look at it like a sanding motion, where you don't go too slow and you don't go too big. Each segment is about 1 inch in length, and you're just kind of going like this in a nice rocking motion. You do it for 10 rolls. Then when you finish that segment, you move to the next one along the line and to hit that whole line.
Okay. So Dr. Ryan, in the past, you've talked to me about the 5-2-2 rule. What is that?
Okay, so it's the 5-10-2-2 rule. It's a guideline. So it's a baseline to what we do. It's just fundamentals of rolling. Now with it, you can always do more, but again, it allows me to control that people don't overdo it. So what it is, we break a muscle into a line, right? Whether it's a vertical line or horizontal line along a muscle, it follows the muscle. So what that is the 5-10-2-2 rule is that on that line, we break it up into 5 segments. 10 is as you roll 10 times. 1, 2, 3, 4, 5, 6, right? You go at a steady pace, but 10 rolls. Twice through, twice a day. So immediately twice through, because sometimes people go one side of the back, then the other, they come back. We don't do that. The second time through actually gets more tolerance, and we get a little bit deeper, okay? And then twice a day. And that's because once a day is maintenance, and twice a day or more is fixing. So the 5-10-2-2 rule is simple. It's 5 spots along a muscle line, okay? 10 rolls per spot, twice through, twice a day.
So Dr. Ryan, in going through that segment 5 times, how do I know when I'm done? Is there a part of the body that I can feel, now I know to switch to the other side?
Absolutely. So everybody's anatomy is different a little bit, just because we have different shapes and sizes and that sort of thing. So it's a general rule. For some people, they may find only 5 spots in the low back, and that's okay. They may think that they need 6. Some may need as little as 3, and it's okay. So really, when we look at the low back, we look at the bottom of the rib cage to the top of the pelvis, right? So at the bottom, I typically like to go top down. So when you start at the bottom, you start bumping into a bony area, you're done. And it's okay to bump into the bony area, right? Muscles attach into bones. So it's okay. We don't want to be overly aggressive with it, but that's where it tells you that you're done the range that you're doing.
Dr. Ryan, in using the foam roller, I feel like I have a higher pain tolerance, that I can get a little bit deeper. That's when you suggest using the softball?
Absolutely.
Okay.
So it's a couple things. It's to tolerance, it's how tight you are. But again, when we want to look at the ball, some people can begin with the ball because the roller does nothing. But some beginners want to advance it. Just like any workout, you would want to progress it. You don't just start with one thing and then say, oh, that's good. You really base it on discomfort. If you can tolerate the discomfort of the roller, it's time to progress. So the nice thing about that roller is there's layers of it, so you can progress that roller. But eventually the roller with a low back, especially for someone like you, is going to run its course. Now, you've been using a ball for a long time, but that's just because tolerance and tightness for you permitted that, right? So eventually we do want to progress somebody to a ball just because it's going to get better depth and have the most therapeutic effect. So that's where we're going to shift to the ball, but it is going to be a different body position to allow for comfort and ease. So to roll the low back with a ball, it's going to be different than we showed you with the roller. So I'm going to get Brandon to lay on his back. Okay. Now what he's going to do is he's going to lift his butt up off the ground, and then he's going to slide the ball under the low back. Now, of course, we're never central underneath the bones, just offset, and then he's going to let the butt drop down with his body weight as much as he wants. Now, you can always use elbows to support if needed and add some lessening of the pressure, but he has great tolerance, so he's gonna let his body melt over the ball and let his butt hang, and then he's gonna do the same thing where he's gonna rock head to toe and roll in that vertical line down the low back, following the 5-10-2-2 rule.
Okay, so self-explanatory. Once we hit the right side, we then do the left side, right? Now we're ready to move into a muscle group. So where am I going? How am I positioning to get into the hips?
Absolutely. So next we're gonna transition to the hips. So what I'm going to have you doing is you're just going to fall down onto one elbow. You never want to be back on two elbows. It's just too much stress. Now it's very easy because it's just kind of how your body falls. You're in a great position right now with your pelvis on a 45-degree angle. You're just going to switch and pull your right heel behind your left heel. Yep. And so what we do is we want to keep that lower leg on the ground because it's going to relax all the muscles overlying the muscle that we want to roll, because we never want to fight against what we're trying to loosen. So now we're going to take the roller and we're going to slide it underneath your butt. Now that is just above the hip bone. Now we're in the pelvis. And so yeah, so again, just like the low back, it's going to be perpendicular to the spine. It's straight across. And now what we want to do, unlike the low back, is we are going to turn the hip. So we are going to go, you're at 45 degrees, and then you're going to do 5 turns to get to perpendicular to the floor, 10 rolls each. So exactly, so it's underneath there. So we have the body position right. Now you're doing the technique right because we're following the 5-10-2-2 roll. And then you're going to do 10 rolls here, 10 rolls there, and you're just going to do those turns until you're perpendicular to the floor.
Am I okay to pick up my butt as I'm repositioning, or do I want to keep it?
You are. I just find it's more time consuming. I just like to do the transition because it is a relatively easy flow. It's the same thing when you're laying on your back. It's just you could keep repositioning. It's just more time consuming and it's not necessary because you are moving segment to segment. So wherever the previous segment ends, you want the next one to begin.
Gotcha. I'm really just closing my left knee.
Pretty much.
Totally.
Yeah, absolutely. Right? It just brings it forward. The key thing is keeping the right knee, the bottom knee, on the ground, just to keep everything relaxed. What happens is often when people roll and it doesn't work, is they're actually tightening everything. So they're just being counterproductive because they flex the muscle and they're trying to massage it. It's just, you wouldn't go for massage, lay on the table and flex your muscle.
Right.
That just doesn't make any sense.
So Dr. Ryan, I can notice some parts of my hips are tighter than others. Should I focus on that area or still scan the 5 spots?
So to begin, I would always just follow the 5-10-2-2 rule because it's kind of screening and scanning what's going on. But you can always go back to it as you get more experience. Remember that the 5-10-2-2 rule is a guideline. You can always do more. It's just that you can't do less to be effective.
So starting at 45-degree angle, I'm going to work my way down. So I'm doing 10, 10, 10, 10, and 10.
So as you're rolling and you develop more tolerance because you've been doing it for a period of time and you feel like, yes, I'm good, then we can switch. We can switch out the roller, add in the ball. And the thing to understand is nothing changes. Just because you change the tool, it becomes a little bit more of a balance of doing it, and it's going to be a little bit more uncomfortable. But the movement, the body position, everything is the same. Different tool, everything stays the same.
It's amazing. Since switching, if this was, let's call it a 4 on the, let's call it a pain scale, and to get into the ball, it goes up to like a 9. It's amazing how deep you can get with the softball if you can tolerate it.
Yes.
I imagine the deeper we get, the better it is for the muscles.
It is now always just that level between going too much or not enough. We don't want to cause harm to the muscle. for sure, but it will progress it. Now, the other thing to remember is you have to control how much body weight you put down. If you wanted, you could push through the elbow and the knee and lift your butt up to decrease the pressure. Every roll has that same pressure management. If you were doing the back, you could bridge up. If you're laying on your side, you can bridge up.
Okay guys, the last movement we're gonna get into is for our thighs. So Dr. Ryan, maybe instruct me how I'm gonna get into this position for the viewers at home.
Absolutely. So there's a lot of little details that we have to get into this. So I'm just gonna talk about each of them just so that we get it right. So we're just gonna be straight down on our tummy. We're gonna get into a standard plank position. So you're gonna be on elbows and then the balls of both feet. What then happens is we're gonna bend the right hip and knee both to 90-90. And then what Brandon's gonna do is take the roller and put it up and down, perpendicular to the thigh. And then what he's gonna do, his movement is gonna be side to side, okay? And so he's just gonna start rocking. Now, I know we've talked about the 5-10-2-2 rule. This is a very long muscle. If you want to hit more of it, you can add more spots because remember, it's a guideline. And you want to start right up at the groin because that's typically where you strain more and move down. That said, it is going to be most tender, lowest to the knee.
Is that the movement?
It is. So you want to get up to 90 because you're kind of at 45. So you want really up to 90 if possible. Yeah. But see how you're kind of like spreading? I want all angles pretty good. Just like that.
Okay. And is there still 5 segments that I'm finding in my thigh?
There are. Now, if there's more, there's more. But generally, you can follow those 5 segments just like that. And what you want to try to do is turn your right hip down toward the floor.
Ooh. Okay. Wow.
Right? The more you turn down, the more you accentuate. The inner thigh is a stabilizer and a mover for the golf swing, because when you're there, you're trying to lock in between glutes and inner thigh, right? And the other thing is when you're swinging and you're kind of coming up like this, you're putting a lot of tension and stress through here, both in an accelerator and a decelerator, right? So it's kind of like a rotator cuff with a pitcher where you have an accelerator, decelerator, and stabilizer. See, people always forget about this and they're like, why don't I have internal rotation? It's because you're so tight here that it actually blocks that movement.
So in moving the segmentation, am I moving this up or down, or is it side?
Yes, so we're gonna be at 90 degrees, and it is the seam of my pants is how the muscle looks. So we're gonna go along that line. So your position right now is perfect. The only thing I ever tell you is just get on the ball of this foot, because that is going to give you maneuverability. Now also, one other thing for progression is we can lift this leg and hip up off the ground and press this down to accentuate what's going on. So you can see that by lifting that side up, we can transfer more weight over the roller and get more pressure.
So to do the thighs that we're working on, we can also use the ball.
Yeah. In doing so, it's just because the ball is always more unstable. When you're laying down, you know, sometimes when we lay on the back, we can hold it and we can guide it with one of our hands. It's hard with the glutes, but with the inner thigh and you're in a plank position and it's here, sometimes it has the tendency to scoot out. So we sometimes do want to take one hand, hold that ball to stabilize it, because you know it's not the easiest position to hold. And so a lot of these things are really a workout of themselves in addition to having a therapeutic effect.
Okay guys, in wrapping up, Dr. Ryan has given us 3 fantastic exercises to help us feel a lot better at home. If you're in the Calgary area, make sure you come visit Dr. Ryan at Cadence Chiropractic. If you can't figure out why these things are happening at home or why maybe you're not feeling better, it's Dr. Ryan's job to find out why these things are happening. Thank you so much, Dr. Ryan, for having us, and we'll check in with you guys next time.